There are currently 8 adjuvant trials ongoing in the United States and in Europe. In the last 2 years, 2 of those adjuvant trials have reported out. The first is the Asure Trial, which was a randomized trial of sunitinib, sorafenib, or placebo for 1 year. Patients in that trial were grouped into both intermediate and high-risk classification with clear cell and some non-clear histology patients enrolled. And following approximately 1 year of, following approximately 1,300 patients accrued, we noticed a higher than expected dropout rate from both side effects and intolerability. And so at that point, we amended the study to enroll patients at a -1 dose level with a mandatory dose escalation. That trial was presented at GU ASCO in 2015 and was published in The Lancet in 2016. This summer, there was a press release and a later presentation at ESMO of the Strack Trial, which was a Pfizer-supported trial which enrolled patients with clear cell histology with a slightly higher risk stratification of PT3 and higher, and they received 1 year of sunitinib full dose versus placebo. They did not amend their study. Everybody on that study started at a full dose, and they allowed a dose reduction down to 37.5 in contrast to our study, which allowed a slightly lower dose reduction. The trial results of that had a slightly different endpoint also. It was a central radiology review, DFS, as a primary endpoint, and their primary endpoint was a positive trial.